Good afternoon. Welcome to this interactive session. I am Dr. Sarin here from the NAMS auditorium, flanked with Dr. Umesh Kapil, our secretary, and Dr. Ajay Sood, our deputy secretary. Thank you all for sparing time, for joining us. Together we can make a difference and learn from each other. We have about 60 people, 59 people who have joined. I'll start without any delay and show you what the concept for today's presentation is. Ravi, can you show our slides? Yeah, these slides. While we are going on to these slides, today's session is a preparation for our 2023 roadmap. We are very thin here, but when you go across to 600 plus medical colleges and institutes in the country, NAMS becomes rich. And this is probably the only overarching body where we can connect colleges, teachers, students, and everyone together. Let's see how we can achieve it together. Can you go make me live? Okay. So our vision is to have connectivity and also a medical education which is accountable and covers all spheres of medicine, research, and cost-effective healthcare. This is NAMS Vision 2030. So all I can ask you is to contribute to this single-line document. Kindly make a note of it. I'll share these slides. And this has been maybe after days of deliberations by the council. I'll put up what we intend to share with you today. Next. These are our plans for 2023. We know that the National Board has regular courses. Many of you have regular courses, teaching for making people better. But what we thought is to have a preparatory course for not only higher studies, but also competency building. The idea is that we have a pool of 600 medical colleges. We have a pool of teachers. We have a pool of experts with skills. Can we put them into a program by which all of us can learn? The second part is your USP project. And third is get recognized. Next, please. How do we want to do this NAMS preparatory course for higher studies and competency building? We intend to have a consortium where we will have teachers, we will have programs from NAMS, AIIMS, and any other institute who would like to join hands with us. These are all proposals, kindly. Our target is MD, MS, and DNB. But we also would like to go out to people who are in practice and who would like to come back and learn. We do not know how to reach them. We will ask you whether we need to do it and whether it is going to be beneficial. We would like to recognize NAMS mentors. We would request directors of the institutes, deans, HODs to either join themselves or to recommend names of mentors. The way I look at it as mentor is not somebody who is just teaching, who is changing the way medicine is practiced, changing the way patients are seen, changing the way we require outcomes in our sick population. So please think it over. Would you or your friends like to be NAMS mentor? So then there will be no students, there will be mentees. How do you want to do it? Online, in the beginning, a 2-hour course every week. What would be the content of this? We are just working out on this. We would have a project advisory committee, and I encourage you, each one of you, if you have few minutes and if you have the intention, join the project advisory committee. There is no academic head in the advisory committee. We are only here to facilitate, to conceive, implement what you would like. The way we have thought is it could be case-based or it could be an issue-based. The didactic lectures are always available, but can we have cases where each one can teach, each one can learn? A very paltry sum of 1,000 rupees for those who would like to learn for first 3 months. This is the first experiment that we are doing. We may fail, we may do okay, or we may be liked by people and ask for more. So we're not asking for anything beyond 3 months. This is something which we would like to run in the first quarter of 2023. I'll stop here. I'll not go further, and I would like inputs. You can put the inputs through chat box or raise your hand and suggest, is this a good direction? Is this what you would all like to commit your little bit of time and thinking? I'll leave it now open, and then we'll get back to the next point later. I can see Dr. Vora has raised hands. Kindly, you can, if you are connected, please speak, but be brief. We have 100+ people. We'll keep notes. Yeah, please, Dr. Vora. You unmute yourself. We will unmute you. Parul, wherever you are, thank you for appreciating.
Now I have been unmuted.
Yes, please.
Would this preparatory course for higher studies include suggestions for some additions to the present curriculum? That is one. Whether we would also be able to suggest additions to the curriculum at MBBS level, 2. And third, how we would help increase the research tendencies amongst the faculties at college level, not just teaching or not just doing some courses, but also involving their colleagues and postgraduate students to take up some research projects in addition to their thesis. So we have to have these things in our agenda. Okay.
Thank you. We'll keep that in mind. Very useful. Dr. Jamkar, long time we haven't seen you. Very nice. Dr. Arun Jamkar, please unmute.
Please unmute me.
Yeah.
Okay. I'm audible?
Yeah.
Yeah. Thank you, Dr. Sarin. Now, I have been recently elected as a member, and I'm very happy to contribute. Now, first thing is we need to address whether to which faculty or which branches this preparatory course is. So we can't have a universal preparatory course for all. So we might have either surgical branches, medical branches, or something. And accordingly, we have to have curriculum design. And accordingly, we have to hire, say, faculty. We have another organization called Association of Health Professional Educators of India, which is a medical educationist, what you call as body. And I wish we should collaborate with them. I am asking them to write a letter to NAMS to see that how we can collaborate, because the faculty development, taking all these courses, mentors would be very, very easy. Second thing is reaching people is more important. Now, I hope you all know we have something called MU India, which is the biggest, as Google group of medical educators across the country. There are more than 25,000 members. So maybe permit me to broadcast all these messages to them, or maybe Dr. Sarin could be already member, or we could make you all member, or give me a list where they can be member. I think we need to go to everybody. I think this is a very nice move. I would like to be a mentor, and I would like to teach, and I would like to participate. Thank you.
Thank you. All those who are suggesting, please also can mail or put on chat box that you would like to be part of the advisory group, because we don't know as much as you know. You people have worked so hard all your life. So thank you, Dr. Jamkar. We have Dr. Ashutosh, please.
Sir, I am part of Maharashtra University of Health Sciences Medical College Postgraduate Institution. We have taken up many of the public health projects, and we want to integrate the dissertation and the PhD being done in the Maharashtra University of Health Sciences, so that we gradually develop a database and the conglomerate of the knowledge bank, which is possible. We plan to start on virology. We plan to start on gestational diabetes. We are on multimodal learning. So I personally feel that being the member of National Academy and many of the fellows, they should volunteer, and they should in the integrating the work which is we plan at the national level, so that there is duplication is limited, and what to do is available to the available researcher which can lead the science to a higher glory and do better for the students and the science community. I am really thankful, Sarin sir and Madhuri madam. We take it very seriously, and we want to contribute best to the growth of the science through this platform, sir.
Thank you, Dr. Ashutosh. I see Professor Arun Agrawal. Please advise us, sir. Sir, को unmute करना. Yes, sir.
Can you hear me now?
Yes, sir.
Okay. I think after going through your first slide, I really felt that this is one step of NAMS, perhaps to bring a sort of uniformity in medical education pan-India, which consists of more than 600 plus medical colleges. That may be a long-term output of this particular step. And definitely I appreciate this step, because amongst all the medical colleges of India, we have good colleges, we have best colleges, but sometimes we have average college or even below average college. All those below average colleges has to be supported, and perhaps your attempt of having this platform will definitely help that. We are with you.
Very good. So, thank you. Many people have given, so each of these, if you could say also whether you would like case-based or issue-based. And I wanted to label it as a common classroom. NAMS common classroom. So you have a common classroom and you join it wherever you are, and you can also join, you can also teach. So keep thinking about it. We have to very rapidly, because 1st of Jan, we would like to, once you all agree, we have to go to the council to take their advice. And do you think 1,000 rupees is reasonable? It's too much, or it's okay for 3 months? Maybe there'll be many classes in this. Those who say 1,000 rupees is okay, may kindly advise. I also see hand of Dr. Saurabh Vashne. Are you there? I see Dr. Malti Gupta. Thank you, madam. She has been my teacher. Thank you, madam.
Sir, this is Dr. Saurabh Vashne, sir. So very good afternoon, sir.
Yeah.
Sir, first of all, I will just endorse the views of the previous all speakers. It's a very nice initiative on platform of National Academy of Medical Sciences and very much required. Sir, regarding, I think already they have spoken about, so my session will be that we should have a committee, various committees to have different levels of, say, opinion about the issues. You were talking about the fees, sir. I think 1,000 rupee per month for 3 months is the minimum which I think we can keep. It's very much justified. And sir, I just have a curiosity question that for preparatory course, it means that is it specialty wise or it is in general? So can you just illustrate on slightly on that, sir?
Yes, this has been a common question while we were debating ourselves. Preparatory course for a PG or for a MD/MS is a very thorough, it's a very detailed program, and DNB we don't want to compete. It's overall how you handle papers or how you handle your practicals, which is the core for getting through. It is the main idea behind, and we would like everyone's wisdom. I mean, we have 145 teachers across country. We would like everyone's wisdom. We will filter out, but we require this to come to us by 18th of this month. If you can do it today, we will go over it. We will again circulate and then go into. But the idea is not to repeat what is going to be taught or what is in the books.
Yes, sir. Okay. Thank you, sir. Thank you.
Dental colleges. This is one part. So kindly give your advice. I see some of you are very, giving your time to join the advisory committee. We welcome your kind inputs, and please just don't feel that you are young or you are senior or you're director. Anybody can advise, and we would like those advices. I'll go on to the next slide, please. If the next slide is very important from my point of view. Let's say I just heard Dr. Varshney, or I heard Dr. Jamkar or Dr. Ashutosh. I do not know the strength of your college. So your USP is your college USP. Please try to feel. Can you make others mute? Right. The whole idea here is, what is your college so well that people should know? Well, we are very good in surgery, or we are very good in public health, or whatever it is. So the whole idea is, we request you, please spare half an hour, carefully thought by a group of people, to just say whether you have a unique selling proposal for teaching, training, or you have the best skills lab. We don't know. We keep searching, kahan jaye, kisko bheje. Or you have innovations, or you have incubators, or you are very good in public health. You have tie-up with 10 places in the world. So kindly, we request you, each one of you, if you could spare time, to write your USP. NAMS will upload it. So everyone can see. People are only putting up, hamare yahan itne students hain, itne teachers hain, itni classes hain. That doesn't help. What helps is, we are unique. Now you can change it after you have read another 200 colleges. You change and you say, no, they are also good, we are good, so we will add something else for the future. So this is the idea. This is the idea, to please put up your USP. And the students, the teachers, the researchers, the government, they can help in choosing the college. They would like to rotate. Oh, in that gynae is the best. In that pediatrics is the best. External rotations can start. Like we were asked about research. In that, there is a very good animal lab. There is a very good human experimentation area, people would like to join. I'll stop here. I would request you to spare time and now give your inputs on this, or even if you like to have on the previous one, give your inputs, please. Those who would like, I see a raised hand, 365111895. We don't have the name of the college or people. Please identify.
इसमें रेज हैंड कर दो बेटा रेज हैंड
Please speak and guide us. The one with the phone number, can you make them unmute? We will take AIIMS Raebareli first.
Good evening, everyone. This is Dr. Bedi, professor in dentistry. I have a query. Till time, we have only discussed about MD, MS, and DNB. Can we also include MDS in this? Because many AIIMS, they have MDS courses already running.
So nice. We were looking for someone who will volunteer. MDS must be in it. Thank you. Thank you for sharing this.
Thank you, sir. Thank you.
We have Dr. Taneja. DK Taneja, sir.
Yes, sir. Thank you, Dr. Sarin. The previous points all very well spoken. I just want to mention one thing, that from last 27 years, we have been conducting courses for MD, MS, DNB to improve the result. And from 15%, we brought the result in postgraduate level to about 55 to 60%. This has been going on for 27 years now. So that is a very good thing that you have thought of, and we must be doing that. Regarding this thinking of the medical colleges to provide 5 USP, I think every college will come up with this thing that I've got an excellent orthopedic department, I have an excellent surgery department. What you need to do, anybody who provides this thing, there should be a small committee. We should go and inspect their department and give an approval. Yes, we agree that this department is the one where we can really provide the training what a NAMS is looking for of very high standard. That is my point. Just by somebody saying that I am the best may not work. We have to have a committee.
Thank you, sir. Although there can be debates on that, but we take your suggestions, and you have such a huge experience. It will be worthwhile that your experience goes across the country. Yeah, we have many other people who have raised hands. Rohit, we had we have Dr. Surender Kashyap, please. ये फर्स्ट वालों का नाम है, इसको फोन कर दो यार अजय, फर्स्ट वालों को फोन कर देना, इसका फोन नंबर था ना. Dr. Kashyap, please. You have to unmute, Dr. Kashyap.
Good afternoon, everybody. Thank you, Prof. Sarin, for organizing this unique webinar in the history of National Academy of Medical Sciences. It's a unique program that you have initiated. So great as far as the initiative is concerned. I was thinking of why not be involving the universities also, health universities. There are about 17, 18 universities right now. You yourself is Vice Chancellor. So there must be good, some universities which are of some senior stature. They must be having very robust medical education program or something of that sort.
Thank you.
Why not involve them also?
Yeah, we haven't thought of it, but it is such a good suggestion. We have included it. We will reach out to them, sir.
Thank you.
We have Dr. Ravi Kumar. Dr. Ravi, please. And then Dr. Tyagarajan, sir.
Good afternoon, sir.
Yes.
And thank you for the opportunity. I think you need to be given a lot of compliments for this initiative. I wholly welcome it, and I will be part of any team you think I'm fit enough. We have a couple of things in our university, in our medical college, which can be showcased, as you rightly said. One is the Clinical Trials Research Center, done extremely well in attracting international trials now. Second is the research division itself is separate. We are inducting people who are coming back from US after finishing their PhD postdoc to do biomedical research that can be showcased. Also, we have an excellent simulation center where we train not only medical, paramedical, health science group, all of them are trained their practical skills. So all these are available, but I think it can be utilized much more purposefully. And I welcome your idea and you're willing to share it. Thank you, sir.
Yeah, you have such unique USPs. You will be flooded soon. Thank you, Dr. Ravi Kumar. These clinical trials. Very nice. We have Dr. Tyagarajan, sir.
Yes, sir. Good afternoon, sir. Good afternoon. This is an excellent initiative. Really, it will shape up our future postgraduates in the most important area that needs to be done. My only view is, while I could associate in whatever way that is possible, especially in the project advisory committee group, I would like to place that it should not be a replica of the NMC curriculum for them to do. It will be beyond that in a way that you are able to really prime them as research physicians, bringing in certain various kind of talents, which should be a kind of a project-based learning kind of an approach. And as you rightly said, a case-based and the issue-based kind of a curriculum. So the curriculum development, which you said that you are already working on, should be in such a way that our physicians and surgeons are able to evolve as a holistic kind of a capability built people, so that they will be able to become good teachers as well as research physicians. That is what I would like to convey.
Thank you, sir. May I, as a follow-up to your suggestions and guidance, request everyone to please send us at least 2 or 3 issue-based or what you think will be distinctly different than any other program. What do you think we should include in our curriculum? Please send it ASAP. I have Dr. Vimal. Please identify yourself, sir.
Thank you very much, Sir Dr. Sarin. Dr. Sarin has been my mentor and senior, and I am always guided by him. I work with the University of Manchester, but I spent a few months in India working with Southeast Asia, and my specialty is mental health. Two things I will check with you. First is international collaboration with universities. And if that is encouraged, then certainly my university, University of Manchester, I'm sure would be quite interested to collaborate in both training, research, and medical education. Now, talking about my specialty in mental health, obviously I'll recommend that mental health should be given due priority for teaching, training, education, and research. And for that, I will be quite happy to contribute and help and in whatever capacity I can do for the organization. I will be delighted to do that. But just to find out about this international collaboration and role of international expertise. Thank you.
Hello.
Now, can we have Dr. Ravi Kumar? Audio is not getting connected. Can we have Dr. Achal Gulati?
Namaskar, sir. So I think 2 or 3 areas which we need to focus a little bit upon. We keep on talking about them, but we've never actually seriously dealt with on them. One are, I think, the IT medicine combination, the combination of integrative medicine with the AIIMS systems, and focus on soft skills with respect to the medicine. We keep on talking about a lot at every forum on this, but I still feel that we are not devoting too much onto these areas.
Thank you. These are very important. IT, AIIMS, and maybe skills.
Soft skills, sir.
Soft skills, which is totally lacking. Thank you. We have Dr. Arun Jamkar, and who else is
there? Thank you, Dr. Sarin. The first point is we have 14 medical universities across the country. Actually, I was a founder president of their association, and I hope you remember you were the chief guest for one of the conclave in Pune of this medical university conclave. But I have a list of all these vice chancellors, and maybe if you permit me, I could just connect with all of them to find out what are the priorities of the work that we need to do in medical education in the country.
All right. Thank you, sir.
Second thing is I am working at present with Symbiosis International University as a distinguished professor, and we are very good in simulation lab. In addition, Symbiosis, there's more than 12 various different labs.
Please, just sorry to interrupt, just send this on either WhatsApp or you can send on a mail. Yeah. Thank you. I know you well and your expertise. We have AIIMS Patna. I can, Dr. Paul.
Namaskar, sir. I was held up in a meeting with the ministry, with her joint secretary regarding some important issues. So I missed actually the initial part of the meeting. But what I understand that this meeting is mainly to strengthen the academic collaboration between the network with medical institutions across the country, with NAMS as the convener. From our side, what I can suggest, sir, with me actually on my left side, Dr. Srikant Bharati, who is heading the Department of Telemedicine and Teleeducation here. So I would like to know actually how you wish AIIMS Patna to be part of it and how we can contribute. Can you just please
can we go to previous slide? For some people who have joined late, we just go back. Next slide. So I will share these slides. So this is a preparatory course for higher studies, but we have also added competency into this and we will improve upon. These were our initial thoughts. And what we would like is you have yourself time or your faculty. The most important single successful thing in the whole program is a mentor. It's not a teacher. If you would like to become a NAMS mentor, you will have mentees and you can have 90,000 mentees every year from UG, maybe 40,000 from PGs. So you have a huge opportunity of mentoring the country, all the medical people. What we want to provide is an overarching space, what I call as a common classroom. So please think it over. Do you have time? Do you have intention? And of course you have the expertise which others don't have. Join it. It's a single teaching program for all students and maybe private practitioners in the country. We will zero down in next 3 days how we will shape it after hearing from you. Thank
you, sir. Sir, thank you, sir. I understand now. At Patna, the asset we have, rather I'll say our strength is the clinical material.
Sorry, sir. We have a form. We have a form at the end of this. Yes, you just fill up the form and send it over. That is my request to you.
Sure, sir. I'll do that. I'll do that, sir.
USPs. We have Ramesh. I can see Ramesh. Ramesh, you have something to add? Okay. We have Dr. Vora. Ravindra Vora.
Yeah. See, although I was the first person to join this, I forgot to mention two things. See, I have been a co-chairman of WHO's Lancet Commission on Global Surgery, where the aim was to spread the surgery to rural population of 110 countries, of which ours is one of them. So I would like to address this gathering that while we are doing these courses and advancing our medical services, we have to keep in mind how we can reach the rural and tribal population of India and take our advanced medical science to these people. That is one. And secondly, how we can improve the services of PSM, that is Preventive and Social Medicine Department. I see it's really lacking. I'm sorry to say, maybe I am hurting some people in this field, but we are not really giving any
right,
service.
sir. We will take your suggestions.
Yeah, and we should concentrate on these two things out of academics of our medical colleges where all the money is spent. So let us consider how to take professional bodies to rural and tribal population and how to improve our preventive medicine departments of all colleges.
Sir. Right, sir. Thank you so much. But do please put it on the chat box or by mail. I have Dr. Sanitkar with me from Maharashtra University of Health Sciences. Nice to see you, madam.
Thank you, sir. And firstly, congratulations and compliments for an excellent plan to have a mentor-mentee program. I have just a couple of suggestions. One is this I repeat in the chat box, and I was thinking of the same thing which Dr. Sarika pointed out, that we can have a focus group discussion with some postgraduate students to see what do they hope to achieve from this and what are the topics that they would like to get covered. That's one. And secondly, my interaction across this thing, what really is stressing today our postgraduates is not lack of clinical materials, but stress because of lack of basic issues like hostel accommodation, housekeeping services, security. So I don't know, working hours. And this is adding to their burnout and mental stress. So as a group, can we address these issues and bring out these? Initially, the National Board did have working hours. What is there? So at the moment, there are no clear guidelines. Whether the NAMS should take these up as this thing while doing the mentor-mentee. And when we are doing mentor-mentee, it is didactic lectures may not help because mentoring is about listening. So taking out issue-based things, listening to them and letting them send in questions and picking up one kind of a theme common which we would like to discuss, and voluntarily people can join in. If they are addressed and they see a change coming in, they are heard, people would volunteer to join in more. So these are a couple of suggestions.
Thank you. If I take two things out of what you say, correct me. First, you would like to have a feedback from the students what they want.
Yes.
If you could do that, that is the best thing. And in fact, that was one of my points, but I deleted. That will be the best. If each of you can have 10, 20, 30 students, just ask them what they want to be taught or to be shared or to be exposed to. We would be much, much better. Second, and please send it by 18th. The second part is the specific focused group. Suppose somebody wants to have pathology or somebody wants to do more in orthopedics. Then he says, I need mentors on this. I would like X, Y, Z. And NAMS would try and request those experts to help a select group. So this can be a teacher by choice and mentee by choice. And we could probably develop this as something, I never got an opportunity in my life to be taught by Professor CNR Rao. I wanted to learn some basics, but CNR, so something like this, and we will try and connect to the people. Thank you. And I would like this phone number 365-11895. I don't know. We will unmute you, sir. Your hand is raised from the beginning. Can you speak? 365-11895. Would you like to speak? Yeah. Please. We can't unmute. 36. No.
Yeah. So we are now unmuted.
Yes, we can hear you, sir.
Okay. Thanks a lot, sir. I think it's a great initiative. It's really commendable. I think this is the right junction because myself and my colleague, Dean Dr. Ghosh, we were discussing this morning about how to help these new PG students and to overcome their psychological fear. And I think like after the internship there, nobody has mentored them how to go about how to approach their PG studies. So we feel that we need to, really start the first month or two, we need to really mentor these new PGs coming in to really cope up with the stress and the new lifestyle of how the PG residents would be working in. So that is where we need to have this kind of a subject that has to be added to the mentorship in the 3 months course. Should be one of them is to do with the psychological health backup. So this is one of our input that we wanted to share with you, sir.
Yeah. Please put. Please.
We already I've already put that in the chat box. And one more thing, sir, we are very glad to, we are very thankful to you and NAMS for supporting us in the next 2 days. Within 2 days, we are coming up with the first conference, NAMS, under the banner of NAMS at Bhuj. It is the CME for 2 days CME, and thanks to Dr. Velu Nair for being the to accept the chairmanship for this conference. And so we'll be having a very good, successful conference because we already got 160 registrations done so far. So 3 more days, we expect another to have a total of 200 delegates.
Okay, thank you. We have many people who would like to guide us. Dr. Ashok Sharma. Dr. Sharma, sir. यहाँ से करेंगे. Dr. Ashok Sharma, kindly unmute yourself. We have, meanwhile, the IDY Portal, Dr. Bhavalkar.
Yes, sir. Sir, thank you for recognizing us and giving us the opportunity. We will, at the earliest, not only 5, that is minimum, we will see to it that our faculty submits maximum in teaching, skill development, as well as innovations, the USPs.
Right. IDY Portal is a big name, sir, we all know. And but rest of the country should also know. And we are very fortunate that you have spared time to join. And the message should go around. We have not been able to listen to some people. Maybe Dr. Dayal I could see from Patna, and now I see Dr. Bholanath, Institute of National Importance now.
Good afternoon, sir. I'm Dr. Dayal, calling from IIMS Patna.
Yes, please.
And again, a very welcome initiative from your part and on part of AIIMS, NAMS. And what I've already put in the chat box, that we have a very good skill lab. Recently, we organized the first national NELS workshop for faculty from various places. The Union Government, Ministry of Health had sent. So we would like to associate with this program. And apart from other things, the skill lab is one, and others we will send on the mail.
Okay. Is Dr. Ashok Sharma, can you speak, sir? And unmute.
Yes, sir. Sir? Hello.
Yes, we can hear you, sir. Again, you are mute, sir.
Am I audible now?
Yes, sir.
I'm grateful to have a mentor like you. My simple suggestion will be that if we involve, as this is the course we are planning to start for the postgraduate course students, to involve the various associations in the country. So they will be able to give you a very good input and all the activity done by those associations of different organizations. Thank you.
Very good suggestion, sir. We will try to cash on to their wisdom and strength. I will now go to the next slide and I'll take other questions later because we have. So the networking with NAMS, like today, many of you have given your time and we could see each other. This is one forum where senior people can do networking. Networking is not for making money. Networking is for science and appreciating the strength of each other. Next, please. Now, we would like you to enrich NAMS. And in turn, NAMS can enrich you. You can be a fellow. You can be a member. You can be an associate fellow. I was so happy to see one mail from somebody who put A.FAMS. I thought the person must have felt so happy that he is an assistant professor somewhere and wrote A.FAMS. But remember to put A. unless you become FAMS. Then you can be an MNA, MS. There are orations, awards, and emeritus professors. We have so much more to give. These are very small recognition points. We have so many teachers across. So what we want you to tell us, how can we recognize teachers better? How can NAMS recognize teachers? The process for fellowship, membership is quite tough. Orations, awards, huge. Emeritus professor, few. So tell us, how can NAMS enrich you and how can you enrich NAMS? Please give your suggestions either by raising hands or by giving it in chat box. Any suggestions?
Sarin, can I speak?
Yes, please.
Okay. Thank you, Dr. Sarin. The FAMS is the most important thing by which you are honoring a medical man. Now, I was fellow in year 2001. And my experience is that this fellowship is awarded purely on the merit. And now I, being the chairman of this credential committee, I know how difficult it is to make a selection for the fellow. The tragedy is that when you talk about this people getting the fellows or one should get nominated into the fellow, many of the teachers in the medical colleges and other people in private, they do not know anything about FM. Sir, we do not know what is this FM, how it is given, what is the criteria. But everyone knows that how Padma Shri is taken, so they all know about it. So I think there's something is lacking between our publicizing this thing, that what level of people can be nominated for the fellows. The more we get the people for nominated, the better will be the selection, and we can have a good number of the fellows of our NAMS, by which the NAMS can become very rich. You see, we have a large number of population of doctors now in our country. From 30, we have the last constitutional amendment, we have made it to the 60. And I think we must have the fellows 60 if they are up to the mark. I say if they are up to the mark. And this should be very much publicized. And we should tell all the deans, directors and principals that please identify the real academic.
Right, sir. We take your guidance.
Thank you.
this meeting or this webinar is part of that, and we thank you
Yes.
for all your efforts. But what we would like to do, maybe to make a small poster and
Yeah.
send it to all colleges and their
Good.
deans.
That
If
would be
they
very
can-
good. Yeah.
If they can care to display it in an entry or exit point,
Yes.
maybe it will help us. And Ajay, we can do that quickly.
Yes.
I also want to ask you if there is any other way other than these 6. Do you want to add any category which we do not know, with which you can recognize? One of them which we have added today is NAMS mentor. It's a big position.
Yeah.
If you would like to add anything else, please tell us, and it would be done.
No, that's an excellent idea that in this list of about 6 way by which we can honor the people, having the mentor of the NAMS would be another very good thing. The absolutely brilliant idea, Dr. Sarin, I must say. And this
Thank
is
you,
way, and we'll think it over that how we can still have a few things more. Sure.
Yes.
We'll definitely and give you the input for that. Yeah.
Dr. Saroj, please. I saw your hand raised. Is that Dr. Saroj? Can we hear you?
Very good evening, and thank you so very much for this great initiative. I hope I'm audible.
Yes, yes.
Yes. Sir, I just wanted to give a suggestion, like the way we give membership in the fellowships to the postgraduates and the higher education. Can we give this award to the best undergraduate? The people who are actually very aware of teaching, research in their undergraduate time?
Okay, I take your advice. We did a small experiment with the help of All India Institute Delhi in our annual conference. National quiz. Can you imagine a national quiz? And I think 700 or 800 students across India joined. And then there were finalists. And then there were 3 finalists, and they got the award. And this was 50% medical, 50% research.
So
we can take this as a national quiz or national...
yes, sir. Student awardee for the NAMS.
Done.
For maybe particular year limited, like for 2 years, for 3 years, till the time they become members or something like that?
We will have students. They can participate in the quiz.
Yes,
but
sir.
if you have any other suggestion, because we cannot mentor or monitor their quality in the individual colleges.
So that will be like, it has to be based, it has to be connected through the dean or the directors of the institutes. And first we can put up the duty of the state conveners of the NAMS, and they can look for the institutes in their states, and they can forward it to the NAMS.
May I request you to please write down the process?
Right,
and
sir.
If it is agreed, we will be very happy. I can see Dr. Ashok.
Sir, can I say something, sir?
Yes,
Can
Dr.
I say,
Ashok.
sir,
Yes,
I
please.
just want to mention that this is a very laudable and lovable project to me, because giving 2 hours per week or per fortnight, I can afford it for a week, for the cause of teaching is a great thing. I do not think at the moment we need the permission of the director of the institute. We can go through the curriculum and we can decide a topic, a series of topics, say in my specialty or sir in your specialty, and we can schedule the classes at a convenient time in the afternoon or in the evening, maybe not too quickly, but at a reasonable gap, and we can conduct those classes for a couple of hours on an experimental basis. But I can assure you, sir, this is a laudable project, and the amount of talent we have in this forum will definitely open up newer vistas. We can discuss topics, clinical, practical discussion, the transfer of the diagnostic skill, whatever you have thought of, sir, will be wonderful. And this can be done periodically, maybe once in a week, once in 2 weeks. We can make a think tank or a teacher tank.
Thank you,
Yes.
Dr. Das.
So I will write and send it to you, sir.
Please just put it, no, right away, put it on the chat box or later. So we have choose your mentor and choose your mentee. So if the
Yes, sir.
students want to learn from you, which will be very big privilege for them, how
Yes,
to
sir.
know about diabetes, then you can have a group where you can directly mentor and they can have a very good mentor. So we are thinking of having mentors and the mentees connected. I
Yes, sir.
also see hand of Dr. Saurabh Varshney again.
Sir, in the line of discussion going on, so my humble submission will be that what we are thinking, that National Academy should have a strong foundation and mainstream joining should be more of the professionals. So my suggestion would be that one is that when we are conducting a national conference, which we are doing every year, we should be having a specific section for postgraduate and senior residents. By that, we can make them familiar with the working of and the importance of National Academy. And once they know about, then they try to join earliest and they come with us early. Second suggestion will be, sir, if possible, we can have a national conference, one national conference of postgraduate and senior residents only, where they can share their research work, their experience, their case corrections, and with this we'll be making them familiar with the existence and functioning of National Academy.
So
And
if I understand, so we have a National Research Day or
Yes,
a
sir.
research day under NAMS. That is a suggestion, very good suggestion. It's very, very good. And to have postgraduates and all, let's see how we fare in the first 3 months. People may not like us. I would request everyone to just give very focused, clear topics. Let's say diabetes, not diabetes, very focused or area where you would like ophthalmology, very focused topics which students would be enriched. Can we go to the next slide, please? Sorry for jumping many of our other friends. Do we have another slide on this? No? With this, I would like to stop here. We have...
Good evening, sir. May I say something?
Yes, Dr. Gupta, please.
Yes, sir. I'm Dr. Colonel Gupta. I'm Professor Emeritus of Ophthalmology, IIMS Medical College, Talegaon, Pune. Regarding this fellowship and membership and emeritus professor, based upon the experience, hospital experience or teaching experience and research publications, we should give these designations based upon that. Then I have got one query. I am an ophthalmologist. I have found I have been examiner as well as convener, paper setter for the last 22 years in DNB. I have found that particularly in ophthalmology, they lack much in basic sciences. Actually, they work in hospital where DNB recognized hospital, but nobody teaches them basic sciences.
Okay, sir.
So in the beginning, when they start DNB, there should be one course for the first 3 months and which can be centrally arranged for all the DNB students in a particular subject.
All right, sir. We take your advice. I want to stress upon point number 3, Associate Fellow. Associate Fellow is a category which has been introduced from this year. And those who have passed their DM or MCH and are less than 45 years of age and have some, so the criteria are given. So what we wanted is to have fresh blood into the academy and into the main academic program. We will circulate all these details to everyone one more time and would like you to, the last date for I will ask Dr. Kapil is 31st of December is the last date to apply for fellowships, members, associate fellow, and orations awards are 31st of January. Emeritus professor is 31st of January. So please on your own, and we will circulate a poster. You can print it if possible and display at your place. We have two more hands raised. We have Dr. Jamkar and then Dr. Vimal. Please, Dr. Jamkar.
I'm suggesting we should have one oration, NAMS oration per month, which could be, the faculty could be across the country, and it could be organized online, like a stage like MU India, which might be very easy. We need to just identify people.
Very good.
As I told you, we have MU India faculty Google group of 25,000 people. We could create a network and subgroups of NAMS people on that, and then we will be able to network very fast. I think we need to take into consideration the advantage of a big Google group.
Thank you. So we leave it to you. I endorse your ideas, and 25,000 people or students or teachers, if they hear an oration, this will be like, lifetime audience. Thank you. But Kapil, we interact with sir. Dr. Vimal, please, from Manchester.
Thank you, Dr. Sarin, sir. Just, these specific titles doesn't really mean a great deal. As long as, like overseas Indian academics or doctors settled wish to contribute, if they could be added somehow as contributors or whatever. I don't know whether they could be fellows or members or professors or whatever. But if you give some consideration for people like us who really wish to contribute in teaching, training, and education in India, and there are a lot of us, and there are universities as well. Like I can assure you, University of Manchester would be quite keen to work with.
Okay. So I request you and everyone, so kindly give your thoughts. I would like to save everybody's time. We thought till 5:30, but we have finished our agenda. I'll revise. Dr. Agarajan says all quality medical colleges may be included. Okay, sir. I would like you to please not close your eyes once you are through with it. Please write down right away. We will keep the website on for another half an hour so we can have chat. We will go through all the chat boxes. We are not very rich. NAMS has never been a rich association or not academy, but we would like you to contribute in your time. We would like austerity in the beginning. People may be getting 5,000 rupees, 10,000 from other lectures. But right now we are not, but we are trying to make it self-sufficient and honorable. So whoever is a mentor or teacher for some time, at least first 3 months, bear with us that you are giving it to the cause, you are giving it to the nation, and bear austerity measures in the beginning. So this is my humble request, but do volunteer, do come out. This is the only time you can make a difference by being, like you're a surgeon and you have only been teaching in a medical college or in a state, but now you can teach for the whole country. So please specify and please tell us, and we will have by tomorrow, please give whether you would like to be part of the advisory group for the academy, whether you would like to contribute your time. Can you go back to the second slide? Back. Yeah, so we would like directly yourself or if the directors themselves or deans or HODs would like to recommend after, but it is voluntary. It's not imposed. It's your desire to be able to become a mentor and teach. And please give us how we should implement it. 2 hours a week, maybe more, maybe less. Whether you would like to be in project advisory committee, and then what would you do? How would you advise us? And case-based or issue-based. I can see Dr. Malti. Would you like to speak something, madam? You say how you would like to, not whichever way we say. Your way is the best way.
Yeah, thank you. Thank you, Shiv.
Yeah. Yes, madam.
Yeah, what I say is that because there are many things I see from the chat box, but maybe NAMS also wants something from us. So in that way, I can contribute in whatever way you wish. That's why what I said.
Okay, madam.
Yeah.
Thank you. Thank you so much. I have Dr. Madha Banda Kar. Dr. Kar, welcome.
Good evening, sir. This is two things, sir. One is we should be very specific, and second thing, like this is only confined to the academic people, and you can take it to the communities, like those who are interested in working in periphery. They are the part of, they want to part of this NAMS. How can we accommodate and enrich them? This we can.
You suggest how can we have periphery people part of NAMS? I do not know. How can we do that? You can call them NAMS peripherals.
There's something we will to think like that, sir. Many people, like, when I talking to the peripheral, those who are working like this, things, they are interested and they want to be trained also. If we
will have rural medicine backup in the NAMS peripherals. We are so disconnected. So your thought is very good. Please put it on the box, and I would like this to be done. We see AIIMS Raebareli again, sir. Would you have any other advice from?
Good afternoon, sir. Sarin sir and all the senior members who are participating, and I have got a little space created for me to speak few words. Going by this in this first slide where the targets have been mentioned as MD, MS, DNB, and my senior colleague he has also mentioned about MDMS. So I would also suggest one more, that is the PhDs. You can incorporate the PhD here with us.
We'll include. Done.
Yeah, because that is more required now. The medical scientists should be more in number, as they have got, as you will appreciate, that they are in direct contact with the medical science. I am not demeaning the non-medical scientists, of course, if anyone is here. But medical scientists means medical people should get more scope to work as a PhD.
Done, sir. We have taken your suggestion. Anything else?
Number two is that the mentoring of the mentors. So this mentoring of the mentors, as you have proposed online, 2 hours per week, and 1,000 rupees, is it per month or for 3 months?
3 months.
It's 3 months, sir.
Okay, that is very minimum, of course. You have considered it only 1,000. And these mentors, and as a mentor, we have got a tremendous role, yes, to guide the future generation. As you would appreciate that CBME has also come up. And now you are taking it at a higher level for reaching that target of MD, MS and DNB and whatsoever. So for that, it needs a very holistic approach, sir, what I feel to say. And these mentors also should have the access to go to other institutes.
Okay, we are right now online. I'll briefly summarize what you say. PhDs we will include. You have included a new term, mentoring the mentors. It's too tough, but we will think it over. I would request everybody who would like to join the advisory committee to please look into other programs. We don't want to be Me Too. If there is something which is being done by DNB, we would not like, or any other group. So we would like to be different. How can we be different and useful? And in 3 months, maybe we will have 16 or 20 talks. Should it be 2 hours, 3 hours? So suggest us the timing, suggest us the duration, and how can we be uniquely different? If you all can give it.
I think, sir, 2 hours will be too less.
So,
I think
okay.
so, sir. 2 hours will be too less.
Please put in your suggestions. We need committed teachers. We need very brief, crisp presentations. I would not take more time. I would like to save your time. I would like if Dr. Kapil, our secretary, has something to add. Kapil?
Thank you, sir. What is important is that to have the continuous interest of the postgraduates or the medical officers, we need to have topics which are highly relevant to them, because it's very, very difficult to attract the postgraduates to attend these courses. What Dr. Agarwal mentioned, that yes, this might be extremely useful for colleges.
Okay.
Hello. Yeah, this might be extremely, this uniform training program and teaching program would be extremely useful for the colleges. We do not are up to the mark, so their post to come and join this particular program. I think so. This is an extremely important segment, and we can't compare all the colleges in the same rank. We do have some difficulties. And last thing is, like Dr. Kwar and Dr. Vashne and Dr. Bhatia, they have joined with us. We would like to have the NAMS and AIIMS collaboration. That would be of great help to both the parties. Let me put it this way. So, Dr. Kwar, you may kindly think it over, and Dr. Vashne sir, and Dr. Bhatia, are you there? You would like to make some comments? Dr. Bhatia from Director AIIMS BB Nagar.
Sir, I'm Dr. G.K. Pal here, Director
Yes,
of
sir.
AIIMS Patna. I think, sir, this proposal is a good proposal. We can have AIIMS NAMS. I think this proposal can be taken forward.
Okay, sir. Yes, please.
I'm Dr. Churamani. Am I audible?
Yes.
Oh.
Yes, madam. Please, Dr.
My video
Churamani.
is not working, therefore I couldn't be present. I would like to make a small comment. Firstly, thank you so much for organizing this meeting. It is a very conducive meeting for the NAMS to make it purposeful for the entire country for medical education, research, patient care, and skill development. So great of you to think on those lines. I would like here to add that in the consortium that you are planning to make for NAMS and AIIMS consortium, add on NAMS, AIIMS, and allied good national institutions, because we don't want to project NAMS and AIIMS to be the only body. This is a national body, so and there are certain other medical institutions in the country which may not be overall terribly good, but there may be excellence in some special departments. So we should include term NAMS and medical institutions of excellence rather than NAMS and AIIMS consortium.
Yes, madam. I take your point. We will take institutes of excellence. I would like to one more time, before we select or request for the academic advisory committee, we would like, please, your institution, your group to put up your USP. And if your USP is same as the USP of another 20, maybe we need something more. We will get back to you. But whatever you will write will go on to the NAMS dashboard. So I request one more time each medical college to provide just 5, don't make 6. Training, teaching, skills, innovations, and public health. We will upload it for everyone to see. If you do it in 2 days, 3 days time, then by 18th we would like to decide. So please try and after discussing with your team, put it up, and then we will get back to you. Last thing I want to say is, if you think such an interaction with colleges is helpful, can you all have an agenda and we can meet, if not too often, maybe once in 2 months or once in 2 months? Is that a reasonable time to meet? for an hour, hour and a half. Is that a good idea? If you think it's a good idea, please put it on chat box. We'll try and regularly learn from each other. And we intend to start our programs from January 1, 2023. We need people. We need experts. We need mentors. With that, I will save everybody's 12 minutes and we will close early so that you can write and the chat box will be open for another half an hour for you.
Sir, I just have a small suggestion, sir.
Yes, sir. Yes, sir.
Ashok here, sir. Sir, I was just thinking that recently I just happened to attend one meeting by the Royal College of Physicians where one of the Indian doctors, Georgie Abraham, was giving a talk on the advances in the kidney diseases. Very interesting topic. So I was just thinking, sir, we can say if Professor Sarin is going to talk about non-alcoholic steatohepatitis, or Velu is going to speak about the venous thrombosis. I'm just talking at random, sir. You can schedule those talks for about an hour with the introduction for about 30 minutes, and this can be periodic. In addition to 2 hours, all of us going to give for organized clinics for the PGs and the DM students. This can be also one more activity we can try, sir. And I'll be ready to organize it, sir. I will organize the forum where you can address from Delhi. It will pan-India broadcast to all the students.
Very nice. So what you say is actually a way, you have given a good term, clinics, NAMS clinics. This can be considered. We will have issue-based theme topics, didactic or interactive, and clinics. And earlier we got a suggestion that there should be monthly orations by Dr. Jamkar, I think. So we can have one monthly orations. We can do it more often. There is so much to be done, but quality is the hallmark for NAMS. So with that, I would like you to please spare time, put it on the chat box right now. We will get back to it. And then please load your USP and then yours, institutes, your own self, and spread the message of NAMS, not to publicize NAMS, but to connect. And a common classroom across India is our dream. Thank you so much and have a great day. Okay.
Thank you, sir.
Okay, thank you, sir.
Thank you, sir. So much.
Thank you.
Thank you. Thank you.
Thank you, sir.
The picture. Okay.
Thank you so much, sir.
Thank you. Thank you all.
Thank you
One
very
more
much,
time.
sir.
Thank you.
Thank you.
you,
Thank
sir.
you so much. Thank you.
इसको हम तो ऑन रखेंगे ना.